revenue report. That is where the governor's office, as well as the nonpartisan Office of Fiscal Analysis, calculated based upon estimates and tax reporting and sales tax, our revenue relative to our budget needs that's been passed into law. And it's not a surprise, but the numbers are absolutely devastating. We're looking where the coronavirus-induced recession, it's going to rip a relatively unprecedented $7 billion from our expected revenue budget by 2023. And now you got to understand that it really is in the context of our annual budget. We run a biannual budget, so it's a 2-year budget. Each year, it's about $20 billion a year for its operational. I'll share with you in detail the numbers. Up to July 1st, 2020, coming up, we are expecting $934 million in a deficit. That's got to be made up somewhere. And for the next year to 2021, July 1st, we're expecting nearly $2.4 billion in deficit. And the next new budget year, we're expecting over $2 billion in each of those successive years. This is based upon estimates of where we're at right now. The data could be more compelling as we look at reality coming in. It could be worse. So the real challenge is we need to brace ourselves for this in light of the health crisis and all the nuances of what we're dealing right now. These kind of budget numbers under normal circumstances would be just compelling, but they're in the background and we have to really be sensitive in addressing it. And one of the biggest components is how we're going to help businesses reopen, how we're going to get them engaged. Now, the Federal CARES Act, which is what we've heard about, is a federal stimulus package to help our small businesses. And the various programs that you've heard in regards to the acronyms of PPP, EIDL, are all sources where federal money is made available to help our small businesses sustain themselves through this. Now, what we also have heard in the latest iteration, operated by the Connecticut's Department of Labor, in which Representative Devlin will share more detail, is the Pandemic Unemployment Act, which is specifically enacted to help independent contractors and the self-employed who do not participate in our unemployment insurance system. This is a brand new federal program administered by the state to help those self-employed and independent contractors through this crisis of unemployment income. So with all that, I appreciate the opportunity to share this information with people, but truly the numbers are daunting. And once we get past this health crisis, we need to consider reopening up our businesses slowly, but also realize that difficult decisions need to be made relative to either taxation or cuts in our budget spending. It really is a devastating dose of reality followed with the health concerns. The health concerns is dominating right now, but we have to be very sensitive of the budgetary impacts because that will also impact people's lives. So it's not always a good bear news start, but it really is the difficult circumstances in which we are confronted with.
All right, thank you so much, Tony. And following along those lines, everyone hopefully can hear me. Maybe Cristin, give me a thumbs up if you can. Or all right, perfect. So last webinar, I did focus a lot on the CARES Act and the Paycheck Protection Program in particular. I kind of want to just take a step back on the overall federal response and then give an update on the Paycheck Protection Program and where we are today. So historically, state and local governments have had the primary responsibility for protecting the health of their residents. Federal authority was really kind of limited to preventing and controlling disease coming into the nation or moving across state borders. However, obviously viruses don't pay attention to state borders, and some challenges to the public health system and the entire underlying economy are of such a magnitude and scope that assistance from the federal government is essential. In a way, we are experiencing all at once the 1918 flu pandemic with some aspects of the Great Depression. A critical reason federal financial help is needed is that nearly all state governments budget requirements. This means that when a disaster happens or a recession occurs and there's a need for a rapid infusion of funds are needed, states cannot deficit spend, but the federal government must. So there really been three major efforts by Congress to provide federal help to address the COVID-19 pandemic. First, there was the Coronavirus Preparedness and Response Supplemental Appropriation Act. That started back on March 6th. That act was our first action. It was to bolster our nation's historically underfunded public health emergency response capacity. Think about things like developing medical countermeasures, outbreak surveillance and response work, and it also set up disaster loans to small businesses and expanded telehealth. The second initiative was the Families First Coronavirus Response Act. That was on March 18th, and that was focused on financial assistance for those workers who couldn't work because of the outbreak, nutritional assistance to those in need, and assistance in healthcare. Think of like cost-free testing, diagnosing, and an increase in federal fund for Medicaid. The CARES Act was really the biggest of the acts, and it was actually, I would argue, the largest relief bill in our nation's history. And it touched basically on all aspects of the COVID-19 outbreak. And I'm not going to get into all that today because Tony's touched upon it. We touched about it last time. But there, the Paycheck Protection Program is still out there, and I want to talk a little bit about that. So by now, almost every kind of small business, every business heard of this program, the Paycheck Protection Program, often referred to as PPP. It's a temporary loan program. Oh, lost volume. All right, I'll let you back in a second. It's a, hopefully you can hear me. I think Laura Devlin was saying she lost volume, but you can hear me good. Okay, so the PPP program, it provides low interest loans to small businesses covering costs associated with payroll, benefits, office space, rent, and utilities, and debt interest payments. These are like stopgap loans to provide critical financial support so businesses can maintain employee and compensation levels through the crisis. But the PPP program has not gone without controversy. In particular, some of the bigger banks were helping the larger of small businesses, particularly think of companies that have up to 500 employees or ones that have potentially subsidiaries. There was kind of a scene as there were certain people that were jumping to the head of that line. With this second round of funding that came through the Paycheck Protection Program, that is being addressed. So nationwide, as of 5 p.m. on Tuesday, there's been a total of 2.3 million paycheck protection loans have been approved in the second round of funding for a total, it's $181.2 billion. That's about 57% of the round two funding, which leaves about $139 billion left. The average loan size has dropped, which is a good thing because that means smaller businesses have been receiving a larger percentage of the dollars. Generally, the usage of the PP program has also slowed down dramatically after the initial rush. And this could be because of shifting guidance or there's been some concern about negative publicity. But I would say there's still money available. Please do access it. And if you have not gotten your application in and you're a small business and you have any types of liquidity needs, you really should consider accessing it because the PPP loans are forgivable when you use them for things like your payroll or to cover your rent or utilities. And quite frankly, Connecticut has not always done very well when it comes to federal funding. We pay out a lot as a state to Washington, D.C. in federal taxes. We don't get that money back. So under this program, which has this grant component, this is finally Connecticut's chance to hopefully, in our small businesses, to receive the dollars they so desperately deserve and need. So with that, I'll pause. I'll take any questions at the end on that. And at this point, I will pass it off to Laura Devlin, who has been dealing with one of our most important issues, which is, how to deal with unemployment claims, because there's been a lot of people who've been struggling with that. So let me make sure you're not muted, Laura. No, where'd you go? Hold on one second. All right, if I don't see Laura in a second, what I'm going to do is I'm going to go to Cristin and we'll do Laura after her. All right, so Cristin, we're gonna put you up now and have I know you're ready. And then
I'm ready.
We'll come back to Laura.
Yes, I think we lost Laura, so as we wait to get her back. First of all, it's really wonderful to see everyone today. We miss seeing you in person, all of us. And Madam First Selectwoman, it's great to have you here with us today too for this conversation. Before I start talking a little bit about Reopen Connecticut, I just want to, even though I'm not talking about mental health, I'm just going to continue to remind folks this is actually Mental Health Awareness Month, and 211 is a great, easy resource to remember. I shared a number of resources yesterday, or the last time, 2 weeks ago. I am going to try and share my screen if possible. And just so that I can, I'm going out on a limb here, just so that I can share a slide with you. Let's see, I'm gonna move this over here. You guys are seeing not what I want you to see. Let's see if I can figure this out. Here we go. Just give me 1 second and we'll see if this works. Can you guys see this? No, you can't, can you?
Nah.
Hold on. Working on it. This is what, like I said before, this learning process with the, all right, you know what? I'm just gonna stop sharing because I tried. So first of all, for source documentation, and I'll see if I can do this again in a minute, but you can watch the governor's pressers every day on CTN. And yesterday, the governor had the Reopen Connecticut committee come and present what steps, and that's what I was trying to share with you. I'll try and share it actually in the chat if I can, a link to it. But here are the quick steps that are needing to happen to get to the point on May 20th that we can reopen safely. And I will just note that I'm here at home and we're all sharing space, and the printer happens to be here in my space. So when you hear printing, that's what we've got. School is still going on in this house right now. First one is a 14-day decrease in hospitalizations, and we're doing well with that, thankfully. The second one is an increase in testing, and that one needs progress. Right now, the goal is to get to 42,000 tests per week, which is double what we're doing now, and the ability to test all symptomatic patients and move to testing asymptomatic patients. We need a faster turnaround for results, and as you probably heard, the governor entered into an agreement with the other surrounding states to work on supplies. What I want to tell you about testing is, and what you need to know, if you can help get the word out, the CVS testing option up in New Haven has capacity. If people need to get tested, they can go there. The governor yesterday signed an executive order that would allow pharmacists to also do these tests, which is really going to help us ramp up. So they're hopeful. It needs progress, but they're hopeful by May 20th we're going to get there. The third one is contact tracing. We are making decent progress with that. Contact tracing, there are two pieces. There's the technological piece, and then there's the human piece. With the technological piece side, there's a new Microsoft platform the state's going to be using that got up yesterday. They're working on testing that, and also there are about 20 health departments that are beginning a pilot program. The governor expects to get to about 700 volunteer tracers. Testing, tracing, and then we're not going to talk about the ability to supportively isolate folks, but I just will note with contact tracing, participation is voluntary. So how we do with that will depend on how much people who are identified as COVID positive are willing to participate in that and be a part of it, but it is voluntary. The fourth thing is, and there are 7, so the fourth is protecting vulnerable populations. This is another one that needs progress. And just so you know, this is the list that the Reopen Connecticut committee is using as their metrics. As the governor has said, we need to really not be an A+, but an A in each of these areas. Protecting vulnerable communities is really about the ability to test. And again, that capacity is increased because we now have 3 mobile testing vans in partnership with Hartford Healthcare that are going out to particularly underserved communities or our frontline providers, nursing homes, etc. The fifth area is to have adequate healthcare capacity. We're in good shape with this. We've actually met the benchmark, which is to have less than 20% of the beds be occupied by COVID patients. And we're there. This is the message that I have for you about that. If you have needed services that you've been waiting to go get that are really important services, there's concern now from the hospitals that folks who have those quote unquote elective procedures that are actually really important aren't doing them. Now's the time to start going back. The hospitals have that capacity, and there's concern that some of those other health risks will increase. So we've met that goal and we're good there. The sixth one is a 30-day supply of PPE, and we're pretty good with that status. The governor announced that they expect to have a pretty major shipment coming in Saturday, and that within the next week to week and a half, another 50% of the orders that were put out by the state will be coming in. So the supply chain is stabilizing, and that's looking a lot better. Again, working in partnership with Massachusetts, New York, New Jersey, et cetera. That's really strengthened that effort, and will continue to do so going forward. And the last one is having appropriate workplace safeguards. And this is really the big question so many businesses have about how will we open up, how are we going to do this. Tomorrow, the governor, along with the commissioner of the Economic and Community Development, will be releasing more specific guidelines for businesses, really specific protocols that businesses need to meet. And as the governor said about that, May 20th will be a date that you can open up. It doesn't necessarily mean that you should, depending on whether you as a business are going to be ready to do that. So I'm, again, happy to talk more about that in questions, and would point you to yesterday's governor's presser if you want to see an hour-plus long conversation with more details about all of that. Thanks, Brian.
Great. Thank you so much, Cristin. And with that, we've got Laura back. Sorry for that technical difficulty, Laura. And I will turn it over to you to talk about unemployment insurance claims.
Thanks, Brian. I don't know if it was at your end or my end. We've got a household of 5 people working from home here with multiple devices. And yesterday we had issues, so it could just be here, not with you. But anyway, I really appreciate
I had issues yesterday too, Laura, but they were not related to technical items.
I appreciate everybody being here. You know, the piece of good news we've gotten is that we've reached day 14 in this state of having declines. And so that is really positive, and kudos to our first selectwoman in Fairfield, who's really done a great job of trying to keep our community safe. But one of the big topics has been unemployment and the ability for the Department of Labor to be able to process claims. I have to say they've made some great progress, and just yesterday the big red button became live for self-employed individuals on the DOL website. So I just want to point to a couple of things. First of all, there is, I won't try to flip my screen, but I'm going to try to show you an image that is probably reversed, but hopefully you can see the big areas that I just want to point to. The Department of Labor really does have a really robust FAQ, and it is available in this red box if you go to the DOL website. And they highlight in red every new update that they provide. It is worth looking for or looking in if you are having issues as an unemployed but employed by somebody else individual or a self-employed individual. To file for unemployment benefits, when you click that link, you'll notice these 3 buttons. These are critical. So for self-employed individuals, which is the big breakthrough now, and particularly because as self-employed individuals, we don't pay into unemployment, but with this federal benefit, we can benefit from it. So the first thing you have to do through the blue button is to apply for Connecticut unemployment coverage. And likely, what will happen is once you apply, and it is critically important that you enter your information accurately, and that as you go through it, as you complete it, at any point you can also go to this green button And I'll make a point there that the information you enter has to be precisely identical. In the blue button, you will get, once you complete that application, you will get 2 confirming emails. The first will just acknowledge that you submitted. The second will be that your application is being processed. And the third piece is that through snail mail, you should receive a letter either confirming what benefits you're eligible for or denying you benefits. As a self-employed individual, getting denied benefits is key because then you can go to the red button, which is where you can file for the federal pandemic unemployment assistance. It is based on full year 2019 earnings. And the only point I wanted to make on this green button is what the Department of Labor highly recommends is that you complete the information requested here and request direct deposit. That is the fastest way to get your money. If you choose to do a debit card or something like that, it can delay your payments. Payments will also be retroactive, and the $600 additional payment, you don't have to do anything for that. That will be automatically submitted. So that is like the latest and greatest news in terms of the Department of Labor, and happy to address any questions in our FAQ portion.
All right. Thank you so much, Laura. With that, I'm going to pass it off to our First Selectwoman, Brenda Kupchick, who can give an update on everything that's going on in the town. And with that, I will pass it over to you, Brenda. Oh no, did we lose Brenda?
Unmute.
I don't see her here.
I think she just needs to unmute. Are you controlling?
Yeah, but I don't see her video though. That's the problem. Because usually if you're unmuted, you go to the top. Brenda, maybe right here, unmute. I'm unmuting some Brenda. Hopefully it's her. If it's not, I hope you're entertaining this second new Brenda.
Hey, oh, okay, can you hear me?
Yes, we can hear you. Perfect.
Okay. Hello, everyone, and I'll just give a very quick, because it is 12:26, and I think you guys want to give opportunity for people to ask some of their questions. Mostly what I would say would be included in my newsletter that I send out. I just sent out another one yesterday. If you're not signed up for the newsletters, you can go on the town's website, fairfieldct.org, and there is archived lists of each newsletter that I've sent out, and each of them have a host of information. I just want to say that I know everyone's going through a really challenging time right now. All of us, I said the other day to a colleague, you know, for the first time, I think in our lifetimes, we can all say we really are in this together. We are all dealing with the same challenges and anxieties that everyone else is feeling, dealing with the pandemic. So I'm here to listen, and I want to give people an opportunity to ask questions. So I will end it there, Mr. Farnen and Representative Farnen, and I thank you for the opportunity to be included.
All right. Yes. No. We're excited to have you. I must admit, I think you're a bigger draw than us. I will fully admit that. So, so the first question is for Laura, which is Connecticut DOL is being overwhelmed with the number of unemployment claims that have been processed in the last few weeks. It is impossible to reach them by phone, and the Department of Labor employees are assisting with basic questions but cannot answer specific questions, and that's been a repeated concern. So the question is, how can constituents get the assistance they need regarding questions with their unemployment benefit payments?
So that is a common thing that we do here. So let me just take you through a couple of steps that you may have already tried. There are 2 phone lines. Take these numbers down. They're also on the website, 860-263-6975, and also 203-455-4669. 2653. You can continue to try those to get through. It is true they may only be able to address more general level questions. I would also suggest going to the FAQ that I pointed out. They do have specific scenarios. There's a wealth of information there. The DOL does have an email. I'm not going to give it to you because it says it takes 5 weeks for a response. The other thing I would suggest is feel free to email me if I am your state rep or any of us, whoever directly represents you, and we can look into what your specific question is. Without knowing what your real question is, and I don't want you to share it here publicly, you know, we can look into that. And so my email is laura.devlin@housegop.ct.gov. And you feel free to just email me. I can pass it on to anybody else if they are your direct representative. Hope that helps.
All right. And this may be a question for the group. I don't know if anyone has a specific answer to this, but the question is, how many residents have been tested and what percentage of the town's population does that represent? And I got to assume that's a pretty small number at this point. And I don't know if we would have that specific data, but I don't know if anyone does.
Brian, I can address that.
Oh, perfect.
Okay. So the question was, how many people have been tested?
Mm-hmm.
Okay, so we've had total tested is 1,689 people, and positive tests 489, and negative is 1,200. And that comes from our, those are updated numbers as of this morning from our Department of Health. Fairfield.
Okay.
And
then okay.
do you want just statewide? Statewide, we've had about 116,000 tests, which is about 3% of the population.
Okay. And then a follow-up question for Brenda is, I have a powerboat stored in the auxiliary parking lot at the South Benson Marina. I'm at an increased risk and worried about having to move my boat and trailer by the June 15th deadline. Is there a way that I can keep my boat where it is past that June 15th deadline?
So I'll just recommend that that constituent reach out directly to me or to the Park and Rec Department, and we'll get that answered today.
All right, perfect. Other questions we have, how can we reopen certain businesses if we don't have the necessary testing available? Do we need the medical staff of private doctor, dentist offices, walk-ins, labs, hospitals have the appropriate PPE? And I think this probably goes to Cristin and the entire group, which is, you know, there is a plan to open the state, and testing is a essential part of that plan. Anything you'd want to reiterate, Cristin?
I would just emphasize what I shared at the very end of my update, which is what the governor said. For example, round one, and this is going to be true in each round, which will be dates that businesses may open, but they might not be ready. I think the issues around PPP supplies, as we heard, the supply chain is kind of, things are evening out a little bit, but businesses tomorrow are going to be learning more about the specific protocols for each business and what they'll need. And certainly, for example, I think you referenced dentists, Brian. They are at a much higher risk, and they are going to need a much different level of protocol because of proximity and intensity and duration of potential exposure. So what they are going to need to do versus what some of the other businesses are going to need to do is really different. And we're going to see a lot more detail. Actually, not tomorrow, today. Today's Friday. That'll be this afternoon. My apologies. This is this afternoon. And again, if you want to go to CTN, which is like Connecticut's version of C-SPAN, so to speak, and the governor, you can watch live the governor's press conference. You can also access on ct.gov all of the governor's executive orders and press releases that have been put out throughout this so that you can read those source documents yourself as well.
And Brian, just to follow up on that, the Fairfield Health Department is providing PPE to medical offices and also nursing homes and long-term, the long-term facilities have been getting them from the feds and state. And we are working, our emergency management team is working to distribute to businesses through the reopening work that we've been doing, stuff they need, their PPE that they're going to need to reopen.
Brian, if I may, the idea of reopening is one of tremendous pent-up demand. We've got the May 20th date, but I've got to be honest with you. What Fairfield may have as a schedule is entirely different from Putnam, from Old Lyme. Each part of the state has different parameters, and unless we get more widespread testing, a greater amount of population and greater PPE protection, I really hesitate to talk about opening on a greater scale for many of the needs that we have out there for our businesses. There's so many businesses clamoring to open, but ultimately they have to take the step back to consider public safety, public health, and who's to say the customers will come back? This is a brand new normal, and we may have a date of May 20th, and the governor just cited the second phase is June 20th, but I think we have to take a day-by-day situation, and I'd rather for us to have medical facts and a basis of a process that ensures safety. Now, with the cancellation of schools, I also gotten the announcement that summer camps are opening up, and that is another point of concern. There's so many multiple steps that we have to go through. It just can't miraculously say we're open on May 20th and everything's back to some degree of flow. It's going to take a long time, and that's why when I talked in the beginning about our budget deficit, it's impacted by everything that we're going to go through, and we have to consider the consequential and the domino effect of all of this on how we're going to proceed into the future. It's a long road ahead of us, and I think the phrase that's emphasized is we all have to do this together.
And I just want to jump in and say that, and Senator Hwang, you're right. This is a slower process, and we're on these weekly conference calls with the governor's staff, and our emergency management team is then taking that information and working on it in our own way for Fairfield, in a way that we feel is the safe way, and we're working directly with the business community. And I established a business reopening task force, and it's got our economic development director, our zoning, our building, our health, our fire marshal, and we are on a call. I will be participating in a call with restaurants today with our team. We're trying very hard to work with every restaurant in our town to fall under the guidelines that the governor has set up about outdoor dining. And so we're going to be doing some creative things and relaxing some rules that we currently have in place for the town, so they'll be allowed to expand their outdoor dining opportunities in a safe way, and so that they're following the distancing and all of that. So you're absolutely right. We're trying to be helpful to our business community and come up with all the ways or challenges they may face to have in this reopening, whether it be a salon or a retail store, a restaurant, whatever it is. We want to be here as a town to work with them, to try to give them every tool that they can possibly have to open safely, so they can at least start to get some of their income back, and that our citizens can go and use these businesses in a way that's safe too. So you're right, it's a process.
And it's a delicate balance, right,
Very,
Brenda?
very,
It really is a delicate balance. What happens in other towns may not apply to Fairfield, and the governor's reopening council. I think one of the critiques of it is the fact that it is so filled with very talented people, but it doesn't have any legislative representation, and that's a concern, because for us as legislators, all of us here keeping everybody updated, we are representing the grassroots basis, right? We're not on that reopening committee to offer the voice, to be a voice in channeling our legislative municipal leaders to say, hey, this may not be the right situation for Fairfield. We've got to consider that, because once the executive order goes out, and it's been kind of stunning how many executive orders have come out, we have to maintain some degree of balance between the greater good for public safety, but also the legislative process being undermined. So there are balances everywhere, and we have to take it on a case-by-case analysis.
Yes, it's a strange time, and our town attorney has been quite busy dealing with the executive orders, reading them and then deciphering how they impact us. But again, I think there should be municipal leaders on the reopening task force. Well, but again,
Right.
We are where we are, and so when these things come out, we sit down with our people here and try to go through it and decipher how we are going to deliver it in a safe way for our community. So we still have local control is what I'm trying to say.
And I would add, I share the frustration. I think the Reopen Connecticut Committee is not subject to FOI, and I think that's been a frustration for a lot of people. And those points are well taken in terms of both legislative and municipal input. The one thing I'd like to add is that the Lieutenant Governor is leading an effort in conjunction with COST and CCM, our regional statewide groups that work with our municipalities, to ask communities to come up with long-term recovery committees or organizations. And the First Selectwoman, it's great, the business piece, that the long-term recovery group is intended to be kind of a broader cross-section, looking at everything from business to school to mental health to first responders, and including all of that. And I think that's an opportunity, and I've had this conversation with the folks in the governor's office who are leading that effort, to be able to work alongside, for us as a delegation, for the First Selectwoman, for other community members to be working together in lockstep to help make sure that when we look at recovery, we're looking at it from the full spectrum of things. But I know you probably want to get on to other questions, Ryan, so I'll stop.
Yep, I'll do that. And I'll just chime in. I actually agree with everything that's been said. And the one area where I feel like the state response has been lacking, where I think overall it's been good, is in response to nursing homes. If you see, I think in Fairfield, it's 85% of the death. We almost need to start being laser focused on the nursing homes as the area where the most amount of damage and deaths are occurring. But there's no handbook for dealing with a pandemic like this. We're all in kind of uncharted times. Next question, I believe, is probably going to go to Laura first. But I applied for unemployment insurance on March 29th before the new system for self-employed was launched. I still haven't received the UC-58. I'm a tennis instructor and received both W-2s and 1099s. I'm eligible for regular employment based on my W-2s, but I'm also still able to apply for the PUA based on my 1099s, which are greater than my W-2s. So one question, I think the question here is, this is someone whose income is changes throughout the year, and during the outdoor months it's much greater, and they're wondering if in their second and third quarter earnings, which are significantly higher than their earnings in the first quarter and the fourth quarter, is there any way that their benefits could be based on the two highest quarters rather than the entire year? I believe the answer is no, or we'll have to get back to you, but I'll
so there's a lot there's a lot packed into that question. Let me kind of start from the top. First, the DOL says, right, you're going to get this UC form, but they also say if you don't have it, you could still apply for PUA because your denial should be in the system already. So I would suggest go ahead and try applying through the red button. If you're not able to proceed with that, what may have happened is your very first application perhaps wasn't filled out completely or correctly. If you received no communication from DOL, then you may want to go back to the blue button, right? And then, as I mentioned before, you should get 2 email confirmations, check your spam files, all of that. And then you should get a snail mail letter. One thing that would happen, even if you qualify for a tiny state benefit, you have to use that up before you can apply for the PUA. So, and because that's a retroactive payment, it may get, used up right away. And then you can still apply then for the PUA. In either case, for the state or for the federal program, it is really, in a nutshell, an annualized number. I think at the state level, they may take the 3 of the last 4 highest quarters or something like that, but it is still based on an annualized number. So I guess the bottom line is you don't have the letter. That doesn't mean you haven't been denied in the system. If you think you're eligible for state unemployment, you have to use that up first. So I would try both of those things. And I hope that answers your question.
All right. Thank you, Laura. And the next question talks about how the state has been flexible with the pandemic and references the reversing the ban on plastic bags for safety reasons and health reasons. And the question is, well, what about the bottle return deposit? As bottle returns, you know, our areas or in supermarkets are closed to consumers, you're being charged for that deposit, but you're unable to, redeem it. So the question is, should the bottle return be suspended? And what happens to all that money that is taken but is not being redeemed?
Good question. I mean, I would say probably what I've seen just anecdotally on Facebook, some of the posts that I've seen is people with large stashes of those redeemables sitting with, as Tony said, the pent up demand in their garages. But I haven't heard any conversation in terms of executive orders or a plan to do that. I suspect that pretty soon, hopefully people will be able to actually begin redeeming again. I don't have a great answer for that.
The next question I have here is, regarding the CBAC, the state employees in the budget shortfall. So the question is, what are your positions on opening up contracts during the contract cycle? If givebacks are needed, what areas would you support? What about retirees versus active employees in regards to concessions? I'm happy to jump off with this question. I just penned a letter together in the Connecticut Post, and I believe that all public employees, whether they're town, state, and it's hard to start creating carve-outs because there are so many very valuable state employees. But I do think we're in kind of unprecedented times when it comes to the budget deficits, and I would personally like to see all public employees, with a pay freeze. And it's not meant in a harsh way. In some ways, I feel like, there's probably likely going to be things like layoffs and other tougher things around the corner. So if these pay freezes can keep one more person to potentially, hopefully have their job, I think that's the right thing to do. And I think that's the fiscal reality we're in. Others are welcome to chime in.
Yeah, Brian, if I may, I think when we began this process of talking about the budget, and you really don't hear a lot about it, but it's going to have tremendous and consequential effect in everything in our community after this pandemic. You're not only talking about municipal aid, municipal budgeting, but education funding, the social safety net for our nonprofits. Everywhere you look, it's a $20 billion budget that impacts all aspects of our lives in the state, not only from a just point of revenue and taxes, but also for its dispersion of services that are critical. So when you take a look at that and you look at the incredible and devastating deficit numbers that's being projected, and it could be worse than projected, you really need to take a step back and recognize that we have a 8-year standing CBAC agreement that locks in benefits and salary increases that is beyond touchable. And the governor can ask all he wants. We have a binding contract that says unless the union steps up and agrees to a certain degree of concession. Now, they gave some concessions to get to that deal, and it's all relative, but these are unprecedented times. And I do believe that our unions and state government needs to get back to the table. But as I say that, everything's got to be on the table. I think we want to look at the bottle redemption. One of the hardest processes we're going to have to go through is everything has to be on the table. We may have to go back for special sessions, and legislators may have pet bills they want to get done. I have a belief that we don't do anything when we go back into special session but to address the deficit and how we're going to run government and place priorities. The priorities are supporting our municipalities, making sure that education funding is there, and our nonprofits that protect the safety nets are taken care of. So if you want to list priorities, those are it. And obviously, it's going to be tough decisions. So everybody's got to be there at the table, and everybody's got to be in sharing of the sacrifices.
And I would just concur with what Tony was saying, Senator Hwang, in terms of everything being on the table. I think the one thing that has come up most recently are the scheduled pay increases for state employees, where, you know, we're facing 20% unemployment. There isn't an individual in my household that hasn't had their pay reduced or cut, furloughed, you name it. And I know from, you know, the people across our communities, it's also the same, and it's really difficult to see scheduled pay increases going into place. That said, I have not supported taking away existing benefits, but I think forward-looking, as Tony said, everything's got to be on the table. We are in unprecedented times, and the amount of debt that our state was facing before that wasn't being well addressed, and the future outlook that we have as a result of this pandemic, it can't be business as usual.
So the thing that I will add is that when we face these really difficult deficits in the past, our public employee unions have stepped up and have come to the table and have given back over time. And I think we're facing unprecedented times like nothing we've ever seen. And what we're finding in these times is that we as citizens, all of us, are having to rely on those very public employees in ways that we've never had to before. The Department of Labor, our first responders. So I just keep that in mind, because I think that we are all aware of that even more. But we are going forward. We know that I expect everyone will be coming to the table. It'll be out of necessity, because this is orders of magnitude greater than what we've seen. But I just want to put it in that context.
And I would supplement that context by saying we value our state employees. They're critical services. But I have to tell you, when we're looking at over 30 million Americans not having a job, everything's got to be on the table. And we might have had deficits in the past. This is catastrophic in its impact. And taxpayers and businesses, everything has to be on the table. And we have to share in relative context. The idea that we're going to guarantee pay increases when people and businesses are losing their job, it just goes against the face of common sense and a respect for the people that we represent. People have to go back to the table and share in that sacrifice. I can't say that enough, but then again, so many other components of what we have to do, it has to be on the table. But in regards to this issue of state employees, I think you have to. When taxpayers and businesses are losing their shirt, we can't say you get your tax increase. And when many other states, when New York State has addressed it with their state employees, we shouldn't be far behind in addressing that. It's critical.
Yeah, no, that's very fair. Let me keep going. So I got a question here. I think it's probably for Brenda. The town update email stated the town is seeking some clarification and further guidelines from the governor's office, which we were told will be provided for restaurants on Friday, for salons next week, and for childcare and summer camps on the 15th. I believe that is correct. And then it says, it's a little bit of a leading question. They can't be proposing to open childcare facilities and summer camps for a May 15th date, or for any time in the summer when schools will remain closed for the remainder of the year. How can that be safe? And I'll give it to you, Brenda.
So I'll just say that whomever submitted that question, I think, misunderstood the newsletter. What we said is that we are getting guidelines on May 15th from the state on certain things, specifically the restaurants, more clear guidance, and other things. But as far as the first of all, child care was never mandated by the state of Connecticut to close. It was voluntarily up to certain child care places. Some stayed open, some did not. Camps, they're providing additional guidance. The federal government sent information to the state that our Park and Rec department and our town got. But then the state is working on it, is going to send updated information on the 15th. Now, obviously, most logically thinking people that this is going to be quite a trick. We have already looked at some of the federal guidelines that are going to be reviewed more closely by the state and given to the towns and municipalities on May 15th for a potential June opening, correct? So it's going to look like what most of us think, right? We're getting guidance from the CDC and from the state that we're not to have mass gatherings. So think about it. Typically in our town, we have about 175 students at each school location for camp, spread out throughout 6 schools. Now we're working with our school system as well, who is going to need some of these schools for summer school. So that reduces, but we also have 11 elementary schools. We have 3 middle schools. We have 2 high schools. We also have a closed senior center. We have closed libraries. So those are some of the things we're taking into consideration. But again, we can't have the normal camp format or protocols that we had before. So, we're looking at potentially, groups of 10 children with a camp counselor, and there's a whole host of things, temperatures, on your forehead and all of this. So it's quite complicated. We do want to work very hard as a community, town government, to try to provide this for people, because we know that it's crucial for families to get that piece in place for them to go back to work. So if we're opening our businesses, people have to have somewhere to have their children taken care of. So we're working really hard to try to figure this out. And again, the guidelines will be coming on May 15th. That's not the opening date. And I think that the rest may have just misread that part in the newsletter.
Okay. Another question we have here is, can anyone provide an update on DMV opening up for learners permits testing and plans to get through the backlog for road tests? Seems to be a parent of a probably very eager 16-year-old.
So I'm happy to address that. At this point, there is no scheduled reopening of DMV. They've moved a lot of things online to continue processing. Of course, that is one thing that can't be. But at this point, it's TBD in terms of when the DMV will start reactivating learners permits and that kind of thing.
And
I was just going to ask quickly, my chief of staff just informed me that her license expired during the pandemic. So how would that work, Representative Devlin?
So there's actually, I think it's a 90-day. I would suggest that she go to the DMV website. I think there's a 90-day extension for expired licenses, et cetera.
And that also applies for registrations as well.
Yes.
Okay.
Yeah, and
If Jack is, go ahead.
I was just going to add, Madam First Selectwoman, mine is about to expire. So, but the governor did actually yesterday at his press conference, or actually Josh Cabal, reference the fact that they had an all commissioners meeting just yesterday, and they're looking at each department now and expect in the coming days to be able to start talking about what the needs are there. So it is TBD, but just know that those are very active conversations happening right now.
So this is the last from our questions that we received in advance, and I do apologize to the Zoom group chat questions because we likely obviously won't be able to get to all of them before the 1 o'clock. But businesses are preparing to reopen, but there are no hand sanitizer products available online or in stores. The suggestion to have hand sanitizers at business entrances can't be done if we can't get access to these products. Is there anything the town or state can do to get those commercial items to commercial businesses? Now, I know that the CBIA, the Connecticut Business and Industry Association, has been actively involved in this, but if anyone else wants to add in or chime in, please do.
So I just want to say that our emergency management team has been trying to assist in this area, not just with sanitizer, but also with PPE. So everyone is dealing with the same shortages. It's global, but we will assist where we can with those businesses. And then if someone from the state wants to speak about if they know anything about any shipments that are coming into the municipalities.
Well, there's a consortium package to buy, but the idea of reopening, I'm going to rehash what I said earlier. Public health is paramount, and it has to be delicately managed with increased testing, additional PPE equipment. we can't go back to business as usual unless those standards are set, because public safety has to be paramount, and we cannot afford a second wave. And that the unique aspect of this illness is what we do in Fairfield, if it's not proactively done in Georgia or anywhere else, is ineffective. So I think we have a real challenge ahead of us, that we need the PPE equipment, we need a new process, and I would urge us to be cautious in moving forward. And I do want to compliment the First Selectwoman in her process in understanding the importance of that. And it's going to take a long time, but we have to be paramount and focus on public safety and health first, balanced with the need to get back to business reopening.
But it does raise a good point as well, that those things have to be in place. It's sort of like the edict that we all wear face masks starting, it was on a Monday night, I think, and the pronouncement went out a day or two before. So not giving people an opportunity to be able to come up with something, some type of a mask, until it was clear, that you could use a scarf or you could just do anything else. So I think it's important that it's sort of thought through. Sometimes there are pronouncements that are made that raise more questions than anything else, and particularly to the senator's point of safety first. That's really, I think, an important piece of the equation that has got to be addressed. I know I've had that conversation with certain restaurant owners who are like, where are we going to get this? So it is a critical piece of the puzzle.
And I want to personally thank Representative Devlin for making masks for me and my staff, which we use all the time and wash all the time. So thank you very much.
My pleasure.
So this, go ahead, Cristin, and then we'll
one
jump for our last question.
Piece of information to that question, which is similar to what the First Selectwoman said at the local level. Part of that question was asked yesterday by a reporter. And again, reaching out via 211 and to the state emergency management communication, because there is an effort to try and be able to assist. And I would say that the Reopen Connecticut Committee is co-chaired by a leader, the former head of Pepsi, Andrew Newey, and by one of the leading epidemiologists in the nation from Yale, Dr. Koh. And that is exactly what the governor has said repeatedly, is we've got to look at the safety. But to Representative Devlin's point, the ability for businesses to get the specifics as much as we know what they are right now. And this is going to be an evolving situation. And as you listen each day to the presentations that are being made by the teams that are coming out with the governor, we recognize there's a lot of parallel planning that has to happen. But bottom line, people do need to be able to get the supplies they need.
Yeah. All right, since it's 1:01, we're gonna wrap up then. I do apologize for people with the Zoom group chat who still have questions in. You could get, if they're related to the town, you could get them into the town through, what's the best email, First Selectwoman, for them to reach town offices at?
So they can either go on the website and pull down fairfieldct.org and pull down the departments and email the department, or they can email me directly at First Selectwoman at fairfieldct.org.
Perfect, thank you. And for Cristin, Laura, myself, and Tony, if we are your state representative, you could always throw questions to us. And obviously, Tony has the luck and joy of being kind of the umbrella over all of our districts. So you could reach out to your specific state representative or to Tony with any of these questions if you need them answered, and we'll make sure to respond in a timely fashion to move them if you don't feel like you were able to get them addressed. But I feel like we did get a lot of questions addressed today. So thank you so much, everyone, for tuning in and for everyone for participating. And stay safe.
Thanks,
Thank you.
everyone.
Thank you.
Great to see you.
Good to see everybody.